Have you ever developed an unexplained rash, persistent fatigue, numbness, nerve pain, unexplained weight loss, or symptoms that doctors simply can't seem to explain? Many people have never heard of vasculitis until they are diagnosed with it or know someone affected by it. Yet vasculitis is one of the most important autoimmune conditions that rheumatologists diagnose and treat because it can potentially affect almost any organ in the body. In this video, I'm going to explain exactly what vasculitis is, the symptoms you should never ignore, the different types of vasculitis, how it is diagnosed, and the treatments available. Most importantly, I'll explain why early recognition can be so important. I'm Dr. Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology London. Let's start with the basics. The word vasculitis literally means inflammation of blood vessels. Blood vessels are the tubes that carry blood throughout the body. They supply oxygen and nutrients to our organs, muscles, nerves, skin, and tissues. When blood vessels become inflamed, they can narrow, become damaged, or in severe cases, become blocked altogether. This could reduce blood flow to important parts of the body and lead to a wide range of symptoms. One of the reasons vasculitis can be difficult to diagnose is because the symptoms vary enormously depending on which blood vessels are affected. Some people develop skin problems, others develop nerve symptoms. Some develop kidney disease, lung problems, headaches, or visual symptoms. There is no single symptom that every patient experiences. Now, vasculitis is considered an autoimmune disease. This means the immune system mistakenly attacks the body's own blood vessels. We don't always know exactly why this happens. In some cases, there may be genetic factors, environmental triggers, infections, or immune system abnormalities involved. One of the most important things to understand is that vasculitis is not a single disease. It is actually a group of diseases. Rheumatologists classify vasculitis according to the size of the blood vessels affected. Large vessel vasculitis affects the body's largest arteries. Examples include giant cell arteritis and Takayasu arteritis. Medium vessel vasculitis affects medium-sized arteries. Polyarteritis nodosa is one example. Small vessel vasculitis affects the smallest blood vessels and includes conditions such as ANCA-associated vasculitis, microscopic polyangiitis, granulomatosis with polyangiitis, xenophilic granulomatosis with polyangiitis, and IgA vasculitis. Now let's talk about symptoms because this is what most people are searching for. Many patients initially develop very general symptoms. They may feel unusually tired. They may lose weight unintentionally. Some develop fevers, night sweats, muscle aches, or a general feeling of being unwell. These symptoms can be quite non-specific, which is one reason vasculitis is sometimes overlooked initially. Skin changes are among the most common signs. Patients may develop unusual rashes, purple spots, red spots, bruising-like lesions, or areas of skin ulceration. Sometimes these skin changes are caused by inflammation affecting tiny blood vessels within the skin. Nerve symptoms can also occur. Patients may develop numbness, tingling, burning sensations, or weakness affecting the hands, feet, or limbs. In some forms of vasculitis, blood supply to nerves becomes compromised, leading to nerve damage. Patients sometimes describe symptoms appearing quite suddenly. The kidneys are another organ that may be affected. One of the challenges is that kidney involvement may not initially cause obvious symptoms. Blood tests and urine tests may be the first clue. This is why laboratory investigations are often so important in suspected vasculitis. The lungs may also become involved. Patients can develop breathlessness, cough, chest discomfort, or occasionally coughing up blood. When vasculitis affects the lungs, prompt assessment is extremely important. Now let's discuss one form of vasculitis that many of my patients have heard of, giant cell arteritis, often called GCA. This is a type of large vessel vasculitis that typically affects people over the age of 50. It causes inflammation of arteries around the head, scalp, and neck. The symptoms of giant cell arteritis are particularly important because it can threaten vision. Patients may develop a new headache, scalp tenderness, jaw pain when chewing, visual disturbances, or sudden loss of vision. If any of these symptoms occur, urgent medical assessment is essential because prompt treatment can help prevent permanent vision loss. Many patients with giant cell arteritis also have polymyalgia rheumatica, which I discussed in a previous video. Shoulder pain, hip pain, and morning stiffness may occur alongside headache symptoms. Now let's move on to ANCA-associated vasculitis. These are some of the more serious forms of small vessel vasculitis. Conditions such as granulomatosis with polyangiitis, formerly known as Wegener's granulomatosis can affect the sinuses, ears, lungs, kidneys, and many other organs. Patients may experience recurrent sinus infections, nosebleeds, hearing problems, cough, breathlessness, kidney abnormalities, and constitutional symptoms. Because multiple organs can be affected simultaneously, the presentation can sometimes appear very complex. Another important form is xenophilic granulomatosis with polyangiitis. This is often occurring in people with asthma, allergies, or elevated eosinophil counts. Patients may develop asthma symptoms, nerve involvement, skin problems, and other systemic features. Now, many people ask how vasculitis is diagnosed. The diagnosis often requires a combination of careful history-taking examination, blood test, urine test, imaging, and sometimes tissue biopsy. Blood tests may reveal elevated inflammatory markers such as ESR and CRP. Specific antibody tests may also be helpful. ANCA antibodies, for example, can support the diagnosis of certain types of vasculitis. Urine testing is extremely important because kidney involvement can sometimes be detected before symptoms become obvious. Imaging studies may include ultrasound scans, CT scans, MRI scans, or PET scans, depending on the suspected type of vasculitis. In some cases, a biopsy is required. This involves taking a small sample of tissue from the affected area and examining it under a microscope. A biopsy can sometimes provide definitive evidence of blood vessel inflammation. Now let's discuss treatment, because the good news is that treatment options have improved dramatically over the past few decades. The aim of treatment is to suppress the abnormal immune response, reduce inflammation, and prevent organ damage. Corticosteroids remain one of the most important treatments, particularly during the early stages. These medications often work quickly and can dramatically reduce inflammation. However, because long-term steroid use can cause side effects, we frequently use steroid-sparing treatments as well. These may include methotrexate, azathioprine, mycophenolate, or other immunosuppressive medications. In more severe cases, biologic therapies have transformed outcomes. Medications such as rituximab have become increasingly important in the management of many forms of vasculitis and have significantly improved long-term prognosis. One of the most encouraging aspects of modern vasculitis care is that outcomes are far better than they were several decades ago. Early diagnosis and effective treatment have dramatically improved survival and quality of life. That said, vasculitis remains a serious condition. Untreated vasculitis can potentially lead to irreversible organ damage involving the kidneys, lungs, nerves, eyes, and other tissues. This is why recognizing symptoms and seeking assessment early is so important. Now let's summarize the key warning signs. Unexplained fatigue, weight loss, fevers, unusual rashes, numbness, tingling, nerve pain, breathlessness, kidney abnormalities, headaches, scalp tenderness, jaw pain, or visual symptoms should not be ignored, particularly when occurring together. The most important message I want you to take away from this video is that vasculitis is treatable, but early diagnosis matters. Because vasculitis can affect so many different organs, it is often called a great imitator. It can mimic many other conditions and may initially seem confusing. However, recognizing the warning signs can make a huge difference. If you've experienced symptoms similar to those discussed in this video, it is worth speaking with your GP or seeking specialist assessment. The earlier vasculitis is identified, the better the opportunity to prevent long-term complications. If you found this video helpful, please like, subscribe, and share it with anyone who may benefit. For more videos on autoimmune disease, arthritis, lupus, vasculitis, osteoporosis, and rheumatology, make sure you subscribe to the channel. And if you would like a specialist consultation, I see patients at Pure Rheumatology London. Thank you very much for watching.